one of the things that was interesting was a conversation about how a lot of coverage of wellness is actually coverage of healthcare, but because wellness as like a concept gets put in lifestyle, the amount of fact checking that goes into those pieces is maybe not as robust as it would be if we were talking about a story that said like, new statin, should you take this for your heart health? It's instead going to be like, you know, supplements that blah, 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 and we're not going to review it with the same intensity that we would if we were calling it healthcare coverage. So I think that's a serious issue.
Welcome back to Making It Awkward. I'm Jessica Wilson, dietitian and author of It's Always Been Ours. You can find me on Instagram at jessicawilson.msrd. This is an independent podcast brought to you by members of the Patreon community. When you join as a paid member, my dad will welcome you to the community. Today's shout out from him comes after our attendance at the Sacramento Pride event, and he's wearing his Pride glasses and lanyard.
Welcome, Flora, to the Patreon. Thank you for your support, for keeping the podcast up and flowing and ready to rock.
And Jennifer,
thank you for your support also, for keeping the Patreon, for joining the Patreon, and keeping this old nutty podcast boy up and just kicking butt. That good enough?
Yeah, that's good.
The unedited and unscripted shout out will be on the Patreon. You can catch this show on YouTube. You can email the pod at makingitawkwardpod@gmail.com, and you can find awkward merch on my website. Today welcomes journalist Lindsay Lee Wallace back to the show to talk about her recent attendance at the Health Journalism 2026 conference. The conference was in Minneapolis, and Lindsay shares how being there post-Operation Metro Surge influenced some of the sessions there. She also talks about what was missing from the presentations and shares a very unique and unhygienic experience while eating chicken tender sliders. Lindsay provides context for the "no one is covering this" effect that I'm always asking her about. And in a fun reveal, Lindsay shares her story of getting kicked out of a Sundance event regarding AI, which may be featured in an upcoming documentary. We start the conversation by talking about my recent invitation to the American Diabetes Association, or ADA, Scientific Sessions Conference. On June 6th, I was part of a panel discussion about what are supposedly controversial topics. I had 15 minutes to talk about ultra-processed foods, and Shireen Chow, another voice you've heard here on the pod, was on the same panel to discuss refugee and immigrant nutrition in also 15 minutes. We'll bring you episodes about those presentations in the weeks to come. I arrived in New Orleans for the ADA conference on June 5th, and later that day learned that people had been escorted out of the conference venue by security and police following a disruption. My initial visions were people with signs protesting the Trump administration's cuts to research and the irreversible damage to public health and health safety by HHS. Maybe they were rallying outside the building before going inside to the exhibit hall. But I was very wrong. The security escort was for researchers who were distributing a 5-page editorial which had already been published in the ADA's own journal. The free access editorial titled "Misguided Brushes of a Pen Continue to Dismantle and Destroy Biomedical Research in the United States. We can no longer afford complacency and fear. We must all act now," included that, quote, "There have been actions by the administration that have caused grave health consequences, and their current approach will continue to do so," end quote. And also that the authors call on all concerned citizens of our beloved country to contact their congressional representatives to declare their alarm about what is happening at HHS. The researchers passing out the editorial who were removed from the conference, including those who were scheduled to present, had their badges taken away and were told not to come back to the convention center. Passing out something that had already been approved by the ADA is something that I thought would be unequivocally uncontroversial and certainly not worth the escort. But in 2026, I was wrong. Lindsay and I get into what this means, and I work through my idea of disruptions and how it can depend on the responses they receive. We were left with questions and would love to hear from folks who were present during the altercation and any authors of the editorial. During the middle of this recording, you'll notice a change in my audio, which then resolves itself. It was over 100 degrees when we recorded this, and my computer overheated for a second. Lindsay and I went on a wild tangent when I got up to turn on the AC in my office, and you can find that discussion of Victorian underwear over on the Patreon. And with that, let's get into the chat. Lindsay, welcome back to the show.
Thank you so much. I'm so happy to be here.
Tell the listeners what you've been up to lately.
Well, a couple weeks ago, I was at Health Journalism 2026, which is the annual conference of the American Healthcare Journalists Association. And it was a very interesting look at what journalists think is important to cover about healthcare right now, and then also updates from healthcare industry professionals.
Yeah. Did you get to see anybody in person?
Not anybody who would be sort of a recurring character of the pod. Certainly, you know, I got to meet Julia Matro, who's the Mother Jones disability reporter. We were talking about her coverage because she wrote a piece about the demise of health publication Self magazine, which went out of business or whatever earlier this summer. I got to meet her. I got to meet many lovely people. I got to meet a woman who was angry with me about how I liked chicken tenders. So, mixed bag.
Are we going to hear more about that later, or should we spend time on that right now?
I'll get into it later. It's okay.
You're sure you'll remember?
Oh, I haven't forgotten since it happened.
Okay. At the top of the episode, I gave a debrief on the American Diabetes Association conference at which I attended with Shireen Chow, another friend of the pod. And yeah, I was expecting like peak boring all around.
And is that what you got?
Not at all. It was not even a news alert, because I will get those. I got a like screenshot of a blue sky message from Natalie. It was random. It said, like, I wonder how many members the American Diabetes Association is going to lose this weekend. It was like, what does that mean? What's happening? Like, what did they say? And then, yeah, Google News tab it, and like, oh, people are being escorted away, like as Shireen and I were arriving on Friday that day. So, spiciest conference yet so far.
Yeah. Tonally, do you feel like everyone else who had to present or who was in attendance or whatever, like how did that affect the event overall and the way that people talked about things?
Okay, this was something that I was very interested in. Friday we got in, and our hotel was one of the ones that was like set up as a conference hotel. So I kept like listening into conversations and being like, okay, so who's talking about this? Like, what are people saying? Eavesdropping, as one will do. And nobody was saying anything. People were just tired. Which I get. It was like 85 degrees and 85% humidity, but I was like, there's nobody really talking about this. Saturday, Shireen and I went through the hall. The vibe was boring, like bored and boring. Like there was no like buzziness or even like any hint that there could have been scandal, like nothing at all. And then in our presentation, it was me, it was Shireen, and still then the vibes were like, like ADA, we're not happy to be here, which was really, it was something. I would expect more, but it seems like it just like happened and everybody went on like business as usual. And I was like, that's where we are. We're like something that makes proper news is just like nothing. Like, is it because it's a drop in a bucket of everything that's been done? Is it because people who attend diabetes conferences like don't care about, I don't know, MAHA? I don't know. It was weird.
Yeah, that is interesting because like at HJ26, people were like, the pervasive air was generally one of being critical of the administration, which is not surprising from a conference full of journalists. Or the conference took place in Minneapolis, and they had already chosen Minneapolis before Operation Metro Surge happened there. But I think that one of the things that was really strong about it was they had a lot of programming about like the negative health impacts of ICE enforcement, and they had a field trip to like a community health center, and then like a panel with the woman who runs that center. So I think that they were very like, that was a situation where I felt like the conference was very responsive to current events, and it really benefited everybody in terms of like what we were supposed to take away and what we were supposed to learn. Like I felt really edified by it as a journalist. And also it's unsettling to hear that like, I know it's not like a one-to-one comparison, but it's unsettling to hear that wasn't the case.
No. no one who had come up to us after the talk mentioned it. When I saw that there was something that had happened, I also thought it was going to be something a lot more controversial than handing out articles that had already been published. I'm like, people were escorted out for this. Okay, cool. The level of tolerance to push back against this administration is so low. And I don't know, I'm not like in this field, so I'm not able to speak of it. And I'm wondering if like that was supposed to be like a protest, if that's like the biggest idea of a protest that people who were interested in protesting came up with, which was like handing out an article that was already in a journal. I don't know because I don't know them.
Yeah. I mean, that is interesting because it's like either that or it was like, they thought, how could we possibly get in trouble or,
sure.
How could these possibly become controversial? We're literally just handing out copies of something that's already been published.
Mm-hmm. And the lead editorial author, Stephen Kahn, a professor of medicine at the University of Washington, said they wanted to give the attendees an alternative viewpoint, which nobody was given an opportunity to present. And I would have to say that he would know, as somebody who likely submitted conference or talk proposals and saw who was accepted and who wasn't. I mean, Shireen and I talked about ICE. We talked about, the Trump administration in a variety of other ways. So I'm wondering, I don't know, I guess I have questions about the scientific communities overall and perhaps their like tolerance for creating conflict and controversy. Maybe I'm not judging these people at all, but the ways that it's been talked about, like, can you even believe X, Y, and Z thing happened? I'm like, if they had invited the NIH director to speak, like they were already like bending the knee to the administration. So yes, you saying something or anything is great. And showing how far up Maha's ass they are is a good thing. But also I'm like, I don't know. I've said a lot of words here and I'm happy these researchers did this. And is that the best that we can do? I don't know.
Yeah, it is like interesting to see what, like you can gauge the level of, I don't know, ideological pressure by how extreme, quote unquote, people think they can get in their dissent. Like if that was the method chosen because it was like the most milquetoast approach that they were certain wouldn't get them in trouble, that's one thing. But if that was the method chosen because they were like, this is really gonna get people fired up, this is gonna like demonstrate that we really think there's a problem, then there are certainly other modes of protest or other examples of direct action that cause more of a stir. Although obviously there's also like the automatic dismissal of people who are going to take a stand in that way.
For sure.
Which feels like very much a tightrope.
Yeah. I mean, if you are getting NIH funding and you're critiquing an administration who is at the end of the day going to give you funding or not, like that's your job, that's your healthcare, that's all of these things. Yeah, so I totally get it. And I do celebrate that it happened, but if they hadn't been removed, like I wouldn't have thought that they were trying to like do anything. The story is in the ADA's response for me, not in their idea to hand out paper that had already been in a journal. Like that, somebody handing out an article like on paper, I'm like, oh, what about the environment? I'm not like, ooh, that's really radical.
It's a Streisand effect thing where the attempt to suppress it called more attention to it than the thing itself.
Sure. I hadn't thought about it actually until just talking to you about it, and I'll have to keep thinking about it. Again, I'm not judging people for their choices or not saying that it wasn't, political or anything like that. I'm just wondering if that is where as a country we are because of our, need for jobs and healthcare and all those things, and the risks that we're able to take and also the risks that we feel we're able to take. And does that say something about how afraid people are? I don't know. Questions I have right now.
Yeah. I do think that's really, I would like to know though. I mean, I feel like there are so many different things that go into a decision like that, to be like, we want to draw attention to X and we're going to do it in Y way. It's obviously not, because I was telling you about the Sundance event that I was kicked out of. This is probably not relevant to the conversation. It's just a thing that I'm talking about now. But
share it right now.
I went to Sundance in 2024 on a fellowship for like critics and journalists who otherwise would not have been able to attend Sundance. And they do it as like an attempt to diversify the kind of coverage that they get and have it not just be like straight white cis men being like, this is a particularly interesting look at World War II. So I think that like, I think that there was like already, you know, me and my friends who I was with were already all very like, oh, we're so lucky to be here. And we were like, I feel very fortunate that I got to do that. But we went to a generative AI demo by an artist whose name is Rashad Newsome. And he had built like an AI model that he had trained to be a tool that he wanted to use to do decolonial workshops. And
Yes.
And he had trained it on like, he was like writers like Bell Hooks and James Baldwin and Audre Lorde and people who I, you know, relate to a lot and get a lot out of their work. And I think this is a really good way of like starting conversations. And it also was like an animated robot that vogued. And, the presentation started with like in the moment it was being generated, it had never been seen before, like 20 or 30 or 175. I don't know. It felt like it lasted my entire life of the robot. The robot was called Being the Digital Griot, and a griot is like a storytelling figure. And he was like, this is a storytelling figure. But he just referred to it as Being, and Being was also his AI child. This is so off topic. I'm so sorry.
It's all good.
So we watched it, and it was very, my friend Grace is like getting an art history PhD. And then my other friend Kelsey is also like a journalist and a film critic. And we were all watching it and kind of being like, this is like awful, right? Like this is like really stupid, right? But also being like, you know, this is like a thing that everyone chose to come to. And ostensibly a lot of the people here are here because they think that this idea is really interesting. So like, let's see what everyone says when the lights come up. And the lights came up and the artist was like, okay, so now everyone is going to get up and talk to Being. And you are going to like stand in front of the theater with your back to the crowd and face the screen and talk to Being. And people were getting up and telling Being like, you know, like, here is the horrible impact that like colonialism has had on my life. And here's like family members of mine. People were saying things that were very emotional. And then they were getting like a ChatGPT AI response. Like, it's really brave of you to share that. Thank you so much for saying that. And then it would also have like a flourish of like, liberation is essential. And it was like, yeah, absolutely it is. But also like how much more like the energy and water and computational power and human effort that went into getting that when you could also just pick up the book it was originally written in is crazy. So I was like talking to my friends and we were all having this reaction to it. And then I was like, I am going to participate in the workshop. And I got up and instead of facing the screen, I faced the crowd and I was like, this is a very like impressive project. And I think it's great that we're all talking about these things. And I also think we can all talk about them without the aid of a technology that is being used in a lot of really harmful ways. And I don't think that it's a good idea to put these thinkers who were focused on liberation into this context that is like ultimately really exploitative. And then my friend Grace from the audience yelled, "Fuck this AI." And then the artist over the loudspeaker yelled, "Fuck you," because he thought that I had said it because I was wearing a KN94. And I was like, ah! And then I went and got back in my seat. And then somebody came down and was like, "You have to leave right now." And I was like, very confused. And I was like, why do I have to leave? I don't understand. And they were like, because you swore. And I was like, I don't know. At the time, I didn't know who had said it. It was just like the dark room. So I was like, I don't know who that was, but it wasn't me. And they were like, the artist is supposed to come on stage for a Q&A, and he says he won't do it until you leave.
Ooh.
And then he like got over the speaker again. He was like, you're going to curse out my AI child. And I was like, I'm not. So then we were all getting up, and my friend Kelsey, who's amazing, was like, fuck this, get up, everybody, let's leave. And a bunch of people like left with us. And like on the sidewalk outside the theater afterwards, people were like, yeah, I thought that was like really disturbing and strange. And like, I was really bothered by the way that they were like, it like felt really hollow and uncanny to hear those things that are important to me come out of like a generative AI thing.
Mm-hmm.
But the thing about that was that I don't think that what I said when I got up was terribly controversial. And if anything, I would imagine that that artist's publicist had a talking point prepared for him to respond to what I said. The thing that took it off the rails wasn't even fuck this AI. It was me getting thrown out and then a bunch of people leaving. So it was like similarly a situation where the nature of the protest, if you can even call it that, was like pretty milquetoast. And the response to it was what made it a thing.
100%. And you're going to be featured in something about it.
I heard that there's a documentary that he made that is called Assembly, and that, as far as I understand, is like mostly about a performance art project that he did that was about like Black queer performers and his childhood. And I think that it sounds like, I haven't seen it, but that part sounds like it's probably great. And then there's also a part where he has footage of me from Sundance, which I didn't know was possible when I decided to participate in that event, but I'm sure was somewhere in the paperwork that I signed.
Yeah.
And he uses that edited in some way that I don't know what it's edited like because I haven't seen it. And then cuts to a scene where he and Being talk about like how sad it is that people are using generative AI. So I personally think it's like a really horrifying thing to do to try to like transpose racism and homophobia and queerphobia and transphobia onto people not liking generative AI in general or your specific generative AI project. Like that is like, you clearly are doing work in this arena that is making all these people you found to do this project feel so incredibly like valued, and you're like creating something beautiful. And I don't understand why you're also doing this other thing. But I'm not an artist. I don't know.
I'm not an artist. That's a really great example. And these two things may or may not, you had something to say. People handing out these articles were doing so that point of view would be seen or heard or read, but not necessarily both attempting to be like inherently protests. And ADA got a bunch of coverage. I have not seen like the media following Miss Rachel, who is doing the work of all of us who really do care about the closure of Dilley Detention Center, who has gone to Congress and talked to or given letters to Congress people about closing, who has sat with children at Delaney Hall and sang like their songs of liberation. So people who are like actively out there and pushing back, getting little to minimal coverage except on social media.
I mean, I think it's like, I saw like a New York Times article about Miss Rachel going to DC, and I didn't read it because I'm not subscribed to the New York Times, so I couldn't. But it's interesting to me when, like, I have seen coverage of Delaney Hall in mainstream publications, and I have seen coverage of Miss Rachel in mainstream publications, including when she was also using her platform in a big way to talk about children in Gaza, which she is still doing, but you know. But I think it's like something that you and I have talked about before, where there's like the no one is talking about this effect. And then there's like the, actually, interestingly, there is mainstream media coverage of this thing, but there's like a difference in the way that the mainstream media talks about something when it does in fact cover it, and when it talks about it, when it's covering it with gusto and like incentive. because it always, like, I have a lot of conversations, like, whenever the hands-off protests happen, my dad will be like, no one is talking about them. And I'm like, that's just demonstrably false. Like, they're covered by CNN and the New York Times and Fox News, although not the way you want them to be. Like, they're covered by everyone. You just don't feel like anything happened because of them. And I agree with that. And I, like, similarly, like, there's a, you know, I have seen, like, interviews with, like, the partners and families of people who are in Delaney Hall, like, hunger striking, saying, like, they're just, like, giving up on, they're starting to eat again or they're starting to work again because, like, there's not enough of a response. And that feels like to, like, pull out your most profound form of protest and to not receive a significant enough response for it to be sustainable is, like, what do you even do?
Interesting. So, I mean, does that go back to your, like, news media cycle conference?
I mean, I think that was weird because I thought that I really appreciated the way that they had, like, reporters from Minneapolis talking about how they had covered the ICE operation there while it was happening. And they had, like, practical information about how changing Medicaid work requirements might help the government get more data about immigrants and, like, things that were very useful and actionable, if that makes sense.
Totally.
And I think that, like, ultimately that's just an organization where, like, no matter how quote unquote fair or balanced you might think that something is supposed to be, people who decide to go to the health journalism conference are going to mostly be people who are opposed to ICE, and they're going to be people who are, I don't know. I'm like not sure exactly what. It's just also, I guess, like a thing of, like, becoming increasingly disenchanted with the power of media coverage of any kind to lead to whatever people hope is going to happen. Because, like, when it's like there hasn't been coverage of XYZ, and it's like there's definitely not been as much coverage of it as there could have been. Like, the coverage has definitely not been optimized to make people pay attention, and that is, like, a different. But it's also like, okay, and if it were, then what would happen next? And I don't mean, like, that's not a responsibility that the media has. I still do delusionally, I guess, believe that the media is meant to, like, hold power to account, or that journalism is meant to hold power to account, not the media.
Fair.
But I'm also, like, you know, I will see people that I know do, like, really good, incisive work about something. And then, like, that's the thing that happened, is that story came out, and did, you know, legislation change as a result of it? Sometimes, but also often no. Or, like, a bunch of people are aware of it, and what did the people do as a result of being aware of it? Were they upset for 15 seconds and then they went about their day? Or did they call their senator who didn't answer because he's eating Big Macs in the White House? I don't know. Like,
yes.
I'm just being really depressing now. I'm sorry.
I mean, given where we are in 2026, I think that's okay. This podcast does not always have to 24/7 be bright and cheery. So then, at this conference, people were escorted out Friday morning. The following day, we saw what looked to be a new newspaper, like Canva newspaper, like template. The title or the top saying, "This is not normal, breaking news censorship alive and well at ADA in NOLA." On Friday, June 5th, members of the American Diabetes Association were escorted by police out of the convention center in New Orleans during the organization's annual meeting, etc. Then it has 2 QR codes, which I thought was amazing. One was a link to the article. The other was a QR code that sent people to, like, the video of them being escorted out. And I thought that was pretty impressive for, like, next day direct action things, being, like, ready with that type of information.
That's very effective in response. And also, I love QR codes. I think that QR codes get their due as a method of directing people immediately to whatever you need them to see. Yes. I mean, obviously, that's a power that can be used for evil, but in this situation, amazing.
Yeah. So it was like, I wondered also, so did folks just come up with that day? Or is it something that they were, like, assuming they would need? Either way, love it. Peak use of the hotel business office is what is what she said. So, but I was like, that, yeah, I like it. I'm into it. Whatever it is, if it is handing out articles or if it is some other means of protest, sit in, or whatever it is, having a QR code ready and putting that up, I think is brilliant.
Yeah. And, you know, I guess it begs the question of, like, if they had it prepared, then did they expect to have a ridiculous response to their utterly calm demonstration?
Right. I do have follow-up questions.
Yeah. Very interesting.
Yeah. Or did outside people who weren't even involved, like, want, like MedPage Today, just quick shout out to MedPage Today for breaking the story. I don't know if I've ever used a MedPage Today source.
I met MedPage Today reporters at HJ26. I mean, the trades don't get their due for, you know, being the only people that are interested in stories that, like, are relevant to everyone. So yeah. Thank you, MedPage Today.
I love it. Yes, thank you indeed for breaking the story. I have to assume that they were there, but I don't know. Okay. And then the president of the American Diabetes Association apologized, and you actually caught that. So it made it around to your side of social media or the news.
Yeah, I was impressed. I was surprised. I didn't expect that because I think that the response was so, like, aggressive and disproportionate and strange that normally when people behave that way, they double down on it. So I don't want to say, like, I was happy to see, because that's not it, but, like, you know, here's to not doubling down on your aggressive, strange behavior and instead walking it back to a degree.
Right. My first click on this apology was like, oh, it's a Black guy. All right. So I wonder if it had not been,
like,
if it had, well, the scapegoating, but, like, I wonder if a white guy would not have would have been fine with doubling down and been like, I make the right choice. I have no values and no moral argument as, you know, to why I wouldn't not apologize. Like, I've done nothing wrong here. But yeah, so also the scapegoating. So too, like, putting this man out there when my guess is that he was not in charge of security that day. They're going to do, like, their internal reviews and whatever it is. And it does make sense that the president of an organization is going to come out and say something. But it was also like, are we going to then put all the blame on you, sir? I don't know. But yeah, it was a 3-minute apology. And at the beginning, he had done the I want to apologize stuff. And then I'm like, I'm listening. And then he actually did apologize. I'm like, you wanting to and you actually doing it are two different things. And then he did. So that was good too.
Yeah, that's true. I guess it remains to be seen, like, how they will handle conversations about this issue in the future, because it feels like some organizations, like professional healthcare provider or, like, organizations associated with a specific condition, have been very vocal in opposition to the administration, or at least have vocally said things like, you know, like, vaccinate your children, please. No matter what the government says.
Yes.
But I guess, like, with diabetes specifically, there's such a rich opportunity for, like, but, you know, or actually there was a session at HJ26 that was, like, the surprising middle ground with MAHA. And the topic of that was all, like, diet stuff and, like, people who are concerned about food not being healthy enough, or concerned about lack of access to fresh food, or concerned about ultra processed foods.
For sure.
And it was very, like, you know, like, if we can get Medicare, Medicaid to, like, really help cover to the point of incentivizing GLP-1 use, and if we can all get together on this, like, that, I'm not saying that specifically was a point being driven home very strongly during that session. That was a, like, I heard that come up. There were multiple sessions that had to do with Medicare, Medicaid, and then also GLP-1s. And so it was, like, a pervasive vibe. Anyway, interesting.
Wait, what was the middle ground?
Oh my God. Yeah. So the idea was, like, you know, everyone wants to, like, what you said about Leslie's perspective being, like, oh, I just didn't know that people couldn't buy good food, or I just didn't know that there were food deserts. I assumed that everyone who isn't eating the way that I want them to eat is doing it out of, personal animosity towards me specifically or something. Yeah. And the idea of it was like, we all want access to food, and you are a person from the left who's concerned about this from a structural position, and I am a person from the right who's concerned about this because I am trying to see the rise of white supremacy within my lifetime. So sure we can find some middle ground, and I'll make corn illegal.
Stop subsidizing corn. But okay, so wait.
So is that what you were hearing at the conference? That there is this conservative side, and then there is this liberal side, and we have a middle ground, and we can find a middle ground? Was that what it was?
I mean, I would say that more so than being the pervasive ideology of everyone, it was like that one session at least was really invested in the idea that everyone cares about access to healthy food. So MAHA priorities about food dyes, etc., the kinds of things where you are consistently pointing out the hypocrisy of people who rose to power saying that they were going to get rid of them and then not doing anything about it, and putting Roundup in the kids' milk at lunchtime and whatever. That the source of unity around that issue is that everyone is angry about that happening. Everyone wants there to be access to healthy food. And then, we're not going to double click down into when that becomes eugenics. We're just going to stay at the surface where we are. The idea that we all want healthy food, which we do.
We want healthy soil. We want healthy farmers.
But we don't want healthy air because it turns out that that's expensive. And so we will just simply repeal the laws that make the air clean, and that'll be fine.
And cut back on the staff of the EPA. It's exactly. That's interesting. I started from people who understand poverty and social determinants of health and conservatives. That's very rude. But that is totally my simplification of groups. And like you said, I learned that there's not even a middle. There's a giant chunk of people who just have no idea what conversation we're having.
Yeah.
Which has been my lesson of 2026. I was making a ton of assumptions. And I'm looking for a middle ground when there is no path. The ground, we're in an ocean and we're looking for the ground. We can't even have a conversation until people understand, what food access isn't, what WIC is, and why fruits and vegetable programs, not why, that they're being cut, that they existed in the first place because people can't afford them. Yeah. Right? We are looking for ground when we're in an ocean. Yeah. Look where this conversation has gone. I feel like we're getting smarter as we're talking.
I think so too. I always feel that way when I talk to you.
Same. Yeah. Any other things that were worth mentioning from your trip, your conference?
Well, I thought that it was really notable how there was basically no discussion about trans healthcare. I think that the response to the really clear attack on healthcare, not just for trans kids, but for all trans people, should be to give us a comprehensive, here is information that you need to know about the legality of this. Here's information that you need to know about the medical consensus or lack thereof on topics that are being made into political talking points. And obviously I didn't go to every single session, and it's entirely possible that they talked about those things at sessions I didn't go to in ways that weren't obvious from the descriptions of the titles. But I think that it deserved more time than it got. There was the journalist Orion Rumler won an award for a piece in the 19th about detransition that was really, really thoughtful and well done. And then as a result of that gave a 15-minute talk that I think that that's great. I just think there should have been more. That's it's a area of healthcare that is being targeted in a really intense way right now. So it's weird that they're not making sure that journalists are equipped to tell that story the same way that they are making sure journalists are equipped to talk about there was a guy from United Healthcare, and for example, I would have rather had, you know, somebody from WPATH than the guy from United Healthcare.
Yes. Good call. Interesting. So that seems like a great opportunity for protest, but.
Well, it was interesting because they were part sponsors of the event.
Oh, okay.
And he was the new, I want to say, chief technology officer or I think it was chief financial officer. And he was very interested in mentioning the existence of his children and wife in the answer to as many questions as he possibly could.
Okay.
And I could like feel the presence of his, you know, PR team in the room being like, remind them that you have a family. And then in fact, the PR team was physically in the room. And he had that recently hired benefit of being able to say, I don't know what we've done in the past, but I know what we've done forward. And I think that if you want to talk about the chicken tender woman, who I promised you I do back to. So what began as a weird interaction about chicken tenders became a conversation about violent rhetoric. And she said to me, you know, oh, you're eating chicken tenders. You know, who else likes chicken tenders? Donald Trump. And I said, weird, non sequitur. And she was like, if you ever interviewed him, then you could eat chicken tenders with him. And that could be sort of the premise of your interview. And I was like, if I am ever physically nearby enough to interview him, I will have other priorities on behalf of the world. And that was a joke that I made, and it felt like, you know, like it's the last day and we're networking and everyone's had their free drink and I'm eating my chicken tender sliders. But she was like stone-faced, like violent rhetoric like that is a really serious problem, and it's like the most serious problem facing us right now.
Wow!
And
what? She
brought up the example of the assassination of Brian Thompson, the United Healthcare CEO, and the fact that there have been multiple assassination attempts on Donald Trump. And she was like, it's, you know, things like that create an environment that makes people behave that way. And I was like, first of all, I'm kidding. I am not suited to be an assassin, and that's why I'm at the journalism conference and not the assassin conference, which I assume exists. They did not even invite me, if you can imagine.
No.
But also, I mean, like, you know, I think that there is like a level of desensitization that it takes to make a joke like that. And then I'm also like, well, you desensitized me by dehumanizing me. Like, you made it so that people are dying because of your actions, and you go around saying things that are incredibly violent. And when I'm saying you right now, I'm talking about the targets of assassination attempts in these situations, the president and the CEO of a company that contributed to, you know, the deaths of tens of thousands of people with its policies. What is the difference between violent rhetoric and violent consequences on people's lives? Because my violent rhetoric doesn't do anything to anybody. And when, you know, the president posts on the internet that he's going to destroy an entire civilization, like that rhetoric is arguably much more violent and also backed up by several more attendances at the assassination convention than I have. So which one of us is the problem? Is it really me?
Well, and you didn't say, you just said you would be doing other things than eating chicken tenders. Is that like?
Yeah, it is. And you know, like I could like go the route of being like, I could have meant anything, but like she knew the joke I was making, and I'm not going to be like
okay.
But I don't know. Also, maybe none of this should be included because I'm afraid of being arrested. I don't know.
Well, I think this is you can decide, but I am back at like what an interesting perspective for somebody in news media to have, because I have heard this, like that she parroted something that I read somewhere recently. Like, so is she afraid? Are people afraid of writing things that are true because they're worried that it will inspire somebody to do something that they should not be doing? I don't know.
A good point. I mean, like, there is like a level of when you report on, like, for example, school shootings, and there's like this playbook about like not wanting to inspire other people to do that. But when that becomes like my stupid joke that I made, which was arguably not appropriate for a professional context, even if I was like, we're all hanging out and having fun, notwithstanding, the stuff that you have read, the stuff that I have read that's like, there's too much violent rhetoric in general is often about like, well, you made, I have seen basically the argument of like, well, you made the president a target by publishing what he said. And it's like, he made himself a person that other people were so afraid of that they thought he was a threat by saying what he said and doing what he did. Like, there's no benefit to pretending that types of violence that are obscured by layers of bureaucracy are like not violent. So it was really weird, like to think of her as a person who is reporting on healthcare right now and a person who is like, arguably setting perspectives about how things are being discussed. And her take was that. I don't know how that informs her reporting. Maybe like she takes a lot of care with it as a result. But I was surprised.
That's wild. Stranger like came up to you as you were eating or like sat down at the same table?
We were like at a table with a group of people and she had been talking to someone else and I had been talking to someone else. And then this was the first moment when we started talking to each other. And there was actually the other woman that we were with. There was a moment where then that woman was like I said something and then the chicken tender woman was like, well, there have been like a record number of assassination attempts on Donald Trump's life compared to other presidents. And then the other woman said, yeah, and maybe some of them were even real. And I was like, we're joking, but it was like, no, we're not joking. And actually, then this is a whole other layer of it. So she used the example of Donald Trump. She used the example of Brian Thompson, the United Healthcare CEO. And then she said, Jewish students can't even walk across the Columbia campus without getting yelled at for being Jewish.
Yes.
And I, based on like, reading reporting by student journalists who are Jewish at Columbia and living near Columbia, I don't think that is true. But even if it were true, I think that she would be doing a massive disservice to what are ultimately like Zionist teenagers, because her argument here is not really about protecting Jewish people. It's about, I'm assuming, protecting people that she thinks are being targeted because of their support for Israel. And so she's saying like, they are the same as people like Donald Trump and the CEO of United Healthcare who genuinely do have the blood of thousands on their hands. Like, I don't think that that's the comparison that you want to draw. I don't think you're doing any favors to like young college students when you make that comparison.
So now we are again like looking at the lens of who's writing what.
Yeah. And I'm like, I think that it's like anti-Semitism is like a genuinely increasing problem. And I think that when you make it look like that is the, like when you say rather than like anti-Semitism is increasing and these students are afraid for their lives. And I'm talking about this in the context of like, we are living in an increasingly fascist dictatorship and like a man who made a Nazi salute was allowed to like help make federal policy. And instead you're going to say like violent rhetoric towards Donald Trump is in line in my mind with the rise of anti-Semitism. It's like, I don't think that you are protecting the people that you think you're protecting.
Right. Especially at a health conference, right?
Yeah. And like,
interesting.
I didn't ask her a bunch of questions to nail down her exact perspectives. And it's entirely possible that I misunderstood everything that she said and everything that she meant. And I'm sure she didn't like that conversation either.
So you had chicken tenders. Was that dinner or lunch?
It was a sort of networking. They were actually little sliders. And then in the slider was a chicken tender, which to me is amazing.
A delightful snack. So how did you, was this like, what day in the series of days was this?
This was the last like night of it. It was like the closing networking event.
Okay.
So everyone was like tired and tipsy. And,
yeah.
She also had a dog, and she was like, the entire time she was talking to me, she was petting the dog, and she was specifically petting the rear end of the dog, and she was specifically running her thumb along the fur immediately around the dog's butt the entire time that we were talking.
No. No. And eating. And where you're eating. Mm-hmm.
Mm-hmm.
Those are the details that I most appreciate about a story. The things that I am 49% focused on are things like that. I'm 51% listening, but also like something else that is deeply disturbing.
And I was like, I need to come up with the perfect way to respond to this. I need to make it clear that this is my exact perspective about political violence. And like, I need to be coherent, but convinced. And then meanwhile, I'm like, please stop touching your dog's butthole in front of my chicken tender sandwich.
Meanwhile, my brain would be like, oh God, what's she going to touch after this? Where is my hand going to be? Is it going to be in the same place? Do I have hand sanitizer? I like 49%, or maybe that's 51. So then I am just like, I don't have anything to say right now.
And that maybe would have been better, because I don't think that I said anything particularly compelling in that situation.
Well, right. And you also didn't give her anything. Like, she can go home and be like, oh, I, was able to teach somebody something, versus like you replying with very valid and important information and her still being like, I don't understand. And then you being like, how? I
mean, I tried, but also I don't think that I am that great at that. So we'll see.
We're all working on it. So how do you feel? Post chicken tender butthole, how do you feel about the state of health news, media, and journalism right now?
Once the news cycle can move beyond chicken tender butthole gate and we can start talking about the serious issues, I think that it is bleak, because I think the entire landscape of journalism is bleak right now. And the need to take corporate money in order to keep publications going is leading to a lot of like journalism influencer overlap, which leads to wellness content, which leads to healthcare misinformation. So I think that there is like, one of the things that was interesting was a conversation about how a lot of coverage of wellness is actually coverage of healthcare, but because wellness as like a concept gets put in lifestyle, the amount of fact checking that goes into those pieces is maybe not as robust as it would be if we were talking about a story that said like, new statin, should you take this for your heart health? It's instead going to be like, supplements that blah, 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 and we're not going to review it with the same intensity that we would if we were calling it healthcare public coverage. So I think that's a serious issue. I also think that generative AI is making up a bunch of weird things about everything, and when it makes up weird things about healthcare, that is one of the most serious situations where you could be wrong. So, eek.
Yeah. I am glad that you're still in this and going to be a health and healthcare journalist. I will continue to learn from you as you go. I think this is super interesting. I've asked you multiple times, maybe your first episode? Was it your first episode? That was What Makes Something News.
Yeah, that was my first episode.
Yeah. And we have wrapped around to that. And your discussion or mention of the news cycle is perfect, because that was like Chris Van Teleken's like wild pictures became like news. We had a news quiz about ultra processed foods, and it just like fully took over everything. Yeah. So Lindsay, thanks for coming back on the show.
Thank you so much for having me on the show. I really appreciate it. I always get smarter when I talk to you, so thank you.
Same. Thanks. Thanks so much to Lindsay Lee Wallace for coming back on the show. It's always great to learn alongside her. In addition to the Victorian underwear outtake, there will be a couple more from Lindsay forthcoming. And Shireen Shah will be back on the podcast in a bit. She and I will go through our presentations from the ADA conference. Until next time, friends, enjoy some chicken tender sliders and make it awkward. I'm Jessica Wilson. This has been Making It Awkward. You can support the show by rating, reviewing, subscribing, joining the Patreon. You can share this episode with a friend. This show is edited by Jen Jacobs, whose work deserves its own QR code. It's supported by the Legacy of Sacramento Outward Services.